Why can't meds work long-term for me? I see so many individuals that have been stable on one medication or a medication combo for years without major issues. But it feels like only after a few months of finally feeling good, my meds just stop working and I'm right back where I started. I am one of those people where psych meds affect me basically instantly. Could that be why none of the meds I've tried last longer than a few months? Has anyone else been struggling with this? So I think there's a general misunderstanding about how psychiatric medications are actually supposed to work and what they're designed for. Now, granted, I do not know this person. I have not seen them. I have not diagnosed them. I have no idea what medications they're prescribed at this point. So a lot of this is some guesswork, but I have a few good theories about what could be going on here. So if someone would walk into my office and tell me this, one of the first things I'm going to consider is this person actually clinically depressed? Depression is kind of like a catch-all for any sort of sadness in society nowadays. It seems like everyone's depressed or people are always thinking someone else is depressed, but there is actually clinical depression, which is an actual illness. Just because you're sad doesn't mean you have clinical depression. So what do I mean by that, okay? So what clinical depression is, it is related to a neurochemistry imbalance in our brain, and it is best treated by medications. However, the thing to remember with depression that I think a lot of people don't understand is that depression is actually episodic. Like clinical depression, actual sickness from this is episodic. It is not constant. So with major depressive disorder, that is the most common depressive clinical depression diagnosis we have, people go through a period of at least 2 weeks. So for most people, it's a few weeks to a few months of being very depressed. So that's low energy, low motivation, usually appetite and sleep changes, and a number of other things. This lasts again for a period of time, but then eventually they kind of get back to normal, okay? So with clinical depression, you're gonna go through this depressive episode, and even without treatment, most people are going to get better. Those symptoms will eventually go away and they will get back to normal. Then they'll have a period of time where they're feeling pretty normal, and then a few months, normally a few years down the road, they're gonna have another depressive episode, and the same thing happens. So major depressive disorder, clinical depression, is cyclic in nature. It is not a forever, you're not always depressed thing. It's kind of like when we get a cold, right? So our body gets sick for a few days or even a few weeks, but then the body repairs itself with antibodies and then we're back to normal. You can think of depression, like actual clinical depression, in the same way. Whatever happens in our brain, we feel more depressed, we feel sick, and then after some time, we're able to regulate ourselves and we are back to normal. So what antidepressant medications are aimed to do is to decrease the severity of those symptoms and the frequency of how often those episodes happen. Antidepressant medications don't really totally get rid of major depressive disorder or clinical depression. They don't get rid of it. They decrease the symptoms when you're in an episode, and they decrease the frequency of the depressive episodes happening. For some people, this might mean that they don't have a depressive episode for the rest of their life or for many, many, many years. But that doesn't mean that their depression is gone. We call that in remission. They're not symptomatic at this current point in time. But that doesn't mean that they're not ever going to get depressed again. So for this person, that might be what's going on here. I know that they said their meds stop working and they're right back to where I started. I don't know if that means that they're back to normal and they feel okay, or if they still have these other sort of stressors going on that's causing depression. And that's where we get into non-clinical depression, or situational depression, it is referred to sometimes. So if someone is telling me that they have felt depressed for many, many years and nothing has really ever helped it, usually they're also telling me that they kind of feel hopeless about life, that they kind of feel lost, they don't have a direction that they're working towards, they don't really know the purpose of them being here. Not saying that they're suicidal, but like they don't know their life's purpose almost. And oftentimes I'll hear too, specific things that they feel are making them depressed. So that could be feeling like they're stuck at a dead-end job, or, at a job they're really not happy with. They're living at home as an adult. They're in debt up to their eyeballs. So usually when I'm hearing these things, they're attributing their depression to things in their life or their environment, and they have felt depressed for a really long time and just don't have this kind of purpose in life. This is what I feel is a non-clinical depression or situational depression. And that differs from clinical depression because this depression, non-clinical depression, is not caused by chemical imbalances in our brain. It is caused by things in our environment, how we interpret those, how we're thinking about those things, but more so how those things or whatever events are going on in our life, those situations, how we are interpreting ourselves because of these stressors or situations in our life. If we're depressed because of these things, we usually have a really negative self-view or internal sense of ourselves, and then we're falling into these really not so great thought patterns. You'll see these usually called negative thought patterns. And that's kind of what's causing the depression. It's the internal sense of self and this filter that we're using and to filter information in our environment. And it's causing these negative thought processes to happen, which then make us feel really sad and depressed. So let's say that's what's going on with someone or this person. So they have all these things that are kind of stressing them out, making them depressed. They don't feel good about themselves. They have some other stuff going on. You go to your doctor, you tell them this. They're like, here, take this medication. What's the medication supposed to do about those things? Right? Do you see where I'm going? Like, medication isn't going to fix the relationship problems, the dead-end job, the feeling no purpose in life. Medication doesn't do that. So those medications aren't going to work for you. And I think this is a really big problem because we tell people, oh, you're feeling depressed, just go to a psychiatrist, go to your primary care doctor, and they'll give you some medicine. And I'm not really faulting the medical providers that are prescribing these things because they're doing what they're supposed to do and what they're trained to do, prescribe medication. But if we kind of zoom out and look at the bigger picture of what's going on with this person and really listening to what this person is saying, they're not telling you or they're not telling me, like, I feel depressed and I don't know why, and I felt this way on and off throughout my life. If we really listen and it's been kind of a constant thing and hear specific things they think are contributing to it, medication probably isn't going to help with that. And you need something else like therapy or coaching or some other sort of behavioral intervention or cognitive intervention to change the thinking and change the behavior patterns. Medicine doesn't do that. So that could absolutely be what's going on here is they took the medicine, maybe they felt better for a little bit because placebo effect or something, but then after a few months, nothing changes in how they're acting, thinking, behaving. So their depression didn't ever really go away because the medicine isn't going to make non-clinical depression go away. So if this person has depression, that could be what's going on. Maybe they don't have clinical depression. It's non-clinical or situational where meds just aren't going to work for this person. But then they also say that they're one of these people where psych meds affect them basically instantly. So that makes me think that maybe it's not an antidepressant they're referencing, and maybe this is more of an anti-anxiety medication. The thing with antidepressant medications or mood stabilizers, things like that, is you have to take those over a period of weeks to really see any benefit. It is honestly, I don't know of any person that's been prescribed an antidepressant or a mood stabilizer and they have felt instantly better, because that's not how they're designed to work. Usually, some people might feel some relief from symptoms within a few weeks, but it usually takes about 2 months for the medication to reach its full effect. That's different from anti-anxiety medications, which do affect people more, I wouldn't say instantly, but quicker. So with anti-anxiety medications, these can be prescribed when we are experiencing anxiety, especially when people are having panic attacks. So that is, again, episodic, not a constant thing. But panic attacks are usually a few minutes, but it causes shortness of breath, trembling, nausea, kind of this overextensional or this just feeling of doom. A lot of people will say that it feels like they're having a heart attack. So you'll see people often go to the emergency room or call 911 because of what they're feeling. Then when you do a medical workup, there's nothing that's found wrong. And usually that's attributed to a panic attack instead. So depending on severity of symptoms and what your provider thinks, you could be prescribed what's called a benzodiazepine or another sort of medication. So similar to antidepressants in that they don't necessarily make the anxiety go away, but they make that panic attack, they make the symptoms less severe and decrease the longevity of how long that panic attack is going to happen. But we run into the same issue with anti-anxiety meds like we do with non-clinical depression almost. A lot of people attribute their anxiety to things in their environment or their lifestyle or how they're thinking about themselves, but usually the environment. So it's a lot of thinking that kind of goes into panic attacks. And if we're not addressing those things that are triggering the attacks, then that person just becomes dependent on the medication. They're feeling a little anxious. They take a benzo and then that goes away. But that's what causes addiction. And that's why benzodiazepines and other commonly prescribed anti-anxiety medications, that's why they are considered controlled substances. And they're getting very, very hard to get for people. And I think that this is for good reason, because I think that if things are attributed to lifestyle, behavioral things, or our thinking processes, then medication isn't going to fix the root of that problem, just like with non-clinical depression. So that could be what this person is referencing when they say that psych meds affect them basically instantly. It could be like anti-anxiety meds in a panic attack, but we also see over time that those do kind of lose their effectiveness over time because we build up a tolerance to those things. And again, they might not be feeling like they're working because they're having more panic attacks and they're not really addressing that trigger for them in the first place. So I don't want you to think that I'm poo-pooing medications, because I'm not. I think psychiatric medications absolutely have their place, and I think that some things do need medications to get better. So things like schizophrenia, bipolar disorders, psychotic disorders, those do need medication to get better because it's a chemical imbalance in our brain. But I think there's a big opportunity area to really take a big step back, especially with depression and anxiety, is to look at the bigger picture of what that person is really talking about and telling us about why they feel depressed. Because I think we kind of throw medications at a lot of people as a Band-Aid, and then they don't get better, they don't feel better, and then that person comes to this belief that medications are a scam, the mental health system is a scam, and no one really ever gets better because we're not treating the things and we're not figuring out, is this a clinical diagnosis? Is this a sickness that needs the medicine? Or do we need some other sort of intervention to help this person not feel so depressed or anxious?